7 mini-stroke signs. Seniors should never ignore. Transient ischemic attack. Margaret turned 74 last month. Lives alone in the same house she and her husband bought 30 years ago. Tuesday morning started like any other day. She woke up with a slight headache. Blamed it on the weather changing. Making her morning coffee, the mug slipped right out of her hand. Crashed to the kitchen floor. "Darn arthritis," she muttered, sweeping up the pieces. Walking to get the mail, she stumbled a bit on the front steps. Nothing serious. Those new shoes from her daughter were probably too big. Around lunchtime, Margaret felt dizzy while heating up soup. She had skipped breakfast, so that made sense. Low blood sugar, right? Her neighbor called that evening. "Margaret, you sound different today. Everything okay?" "I'm fine, dear. Just tired." But here's what Margaret did not know. What happened to her that Tuesday was not just getting older. It was not arthritis. It was not new shoes or skipped meals. Margaret's body was sending her urgent warning signals. Signals that millions of seniors miss every single day. Today, we are going to talk about 7 warning signs that could save your life. Signs that often get dismissed as normal aging, but may actually be your body's way of preventing something far more serious. 1. Sudden, one-sided weakness. Picture this. You reach for the telephone, and your right arm suddenly feels heavy. Not sore from gardening or lifting groceries. Heavy. Like someone drained all the strength right out of it. Or maybe you are walking to the kitchen, and your left leg gives you trouble. Not the usual knee pain you know so well. This is different. Your leg feels weak, almost like it forgot how to work properly. This is sudden one-sided weakness, and it is the most reliable warning sign your body can send. The Framingham Heart Study followed thousands of people for decades. They found this type of weakness in 47% of patients who had mini-strokes, nearly half. That makes it more common than chest pain during heart attacks. Here is what makes this weakness so important. It does not affect both sides of your body like normal tiredness would. It picks one side. Your left arm might feel fine while your right arm struggles to lift a coffee cup. Your right leg works perfectly while your left leg feels unsteady. This happens because blood flow gets briefly blocked to the part of your brain that controls movement. Think of it like a temporary power outage to specific wiring in your brain. The signals from your brain to your muscles get interrupted. Most people notice this weakness during simple everyday tasks. Brushing teeth becomes harder with one hand. Walking feels off balance on one side. Even smiling might look uneven in the mirror. The weakness usually lasts between 2 and 30 minutes. Sometimes it clears up so quickly that people convince themselves it was nothing. Must have slept on my arm wrong, they think. Or probably just overdid it yesterday. But studies suggest this type of weakness may be your brain crying out for help. It might be warning you that bigger problems could be coming. The key difference from normal aging? Normal weakness develops slowly over months or years. This weakness shows up suddenly during activities you have done thousands of times without any trouble. If you notice your arm, leg, or even part of your face suddenly feeling weak on just one side, that may be your most important warning sign. Your brain might be telling you to take action now. 2. Speech difficulties. You are talking to your daughter on the phone. Suddenly, your words start coming out wrong. Not mumbled like when your dentures slip. Different. The words in your head sound clear, but what comes out of your mouth sounds slurred. Or maybe you know exactly what you want to say, but you cannot find the right words. Like trying to remember the name of that thing. You know, the thing you use to, the kitchen thing that makes toast. The word just will not come. This is what speech difficulties during a mini-stroke feel like. The Rotterdam study tracked thousands of people and found speech problems in 43% of mini-stroke cases. Almost half of all patients experienced some form of speaking trouble. Here is how you can tell this is not your dentures acting up. When dentures cause problems, your words sound muffled, but your thinking stays sharp. With mini-stroke speech issues, either your thinking gets fuzzy or your mouth muscles stop cooperating properly. There are two main types. The first type affects how your brain processes language. You might use the wrong word without realizing it. Ask for "that white cold stuff" instead of milk. Or you might understand everything people say to you, but cannot get your own thoughts into words. The second type affects the muscles you use for speaking. Your brain knows exactly what to say, but your tongue, lips, and throat muscles do not cooperate. Words come out garbled or slurred. You might sound like you have been drinking alcohol when you have not had a drop. Both types happen because blood flow gets temporarily blocked to different parts of your brain. One part controls finding the right words. Another part controls the muscles that help you speak clearly. The scary part? These speech changes often last just a few minutes. People think, "Well, that was weird," and move on with their day. They might blame stress, being tired, or talking too fast. But studies suggest these brief speech changes may signal that your brain needs immediate attention. Your language centers might be warning you about bigger problems ahead. If your speech suddenly becomes unclear, slurred, or if you cannot find common words you use every day, that may be your brain asking for help right now. Number 3, sudden numbness. Jane felt it first in her left cheek during breakfast. A strange tingling sensation, like when your foot falls asleep. Then it spread down her left arm. Within minutes, the entire left side of her face felt numb. "Must be my diabetes acting up again," she thought. But this numbness was completely different from the tingling she knew so well. Diabetic numbness creeps up slowly over months. It usually affects both hands or both feet. It starts at your fingertips and toes, then gradually works its way up. Most importantly, diabetic numbness affects both sides of your body equally. Mini-stroke numbness strikes suddenly. It picks one side. Your right face, arm, and leg might go numb while your left side feels perfectly normal. This happens because the numbness comes from your brain, not your nerves. The Frontiers in Neurology study revealed something shocking about seniors and numbness. Only 11% of elderly patients reported numbness during their mini-stroke, but 30% of younger adults noticed it right away. Why such a huge difference? Older adults live with so many different types of numbness that they stop paying attention. Arthritis causes joint numbness. Blood pressure medications can cause tingling. Poor circulation makes hands and feet feel numb. After years of dealing with these issues, seniors often dismiss new numbness as just another part of getting older. This creates a dangerous blind spot. When mini-stroke numbness appears, many seniors think, "Oh, just another numb spell." They do not realize this numbness carries a completely different message. The medical term for this is unilateral sensory impairment. One side of your body suddenly loses normal feeling, while the other side works fine. It might affect just your face, just your arm, or your entire left or right side. Unlike other types of numbness that build up over time, mini-stroke numbness appears within seconds or minutes. It often goes away just as quickly, leaving people wondering if they imagined it. Many seniors never mention these episodes to their doctors. They assume numbness is inevitable at their age. But temporary numbness that affects only one side of your body may be one of the most important symptoms to recognize. Your body might be sending you an urgent message that deserves immediate medical attention. 4. Vision changes. Robert was reading his morning paper when everything went black in his right eye, like someone pulled down a window shade. He blinked hard, rubbed his eye, even took off his reading glasses to clean them. Nothing helped. His right eye saw darkness, while his left eye could see the newspaper perfectly. Then, about 3 minutes later, his vision came back completely. Clear as day. Strange, he thought. Must need new glasses. What Robert experienced has a medical name: amaurosis fugax. It sounds complicated, but it simply means temporary blindness in one eye, and it may be one of the most important warning signs your body can give you. The SOS-TIA clinic studied 2,398 patients and discovered something remarkable. Over 1/3 of mini-stroke patients experienced vision problems. But here is the concerning part. Most standard medical screenings completely miss these symptoms. Amaurosis fugax topped the list at 36.3% of all vision-related mini-strokes. Patients describe it exactly like Robert did. A curtain drops over one eye. Sometimes it starts from the top, sometimes from the bottom. The darkness might last seconds or several minutes. Double vision ranks as another major sign. Everything suddenly appears twice. Reading becomes impossible. Walking feels dangerous because stairs and doorways look confusing. This usually clears up within minutes, leaving people wondering what just happened. Side vision problems create a different challenge. You might lose vision on your left side or right side, while straight-ahead vision stays normal. Imagine trying to drive when you cannot see cars approaching from one direction. Frightening and dangerous. Most seniors blame vision changes on aging eyes, cataracts, or needing stronger prescriptions. These explanations make sense because vision naturally changes as we get older. But mini-stroke vision changes happen suddenly and affect only one eye or one side of your vision field. Normal aging affects both eyes gradually over time. The medical emergency lies in what these vision changes represent. Blood flow to your eye or the vision centers of your brain gets temporarily blocked. When vision returns to normal, people often forget about the episode entirely. Robert should have called 911 immediately. His window shade experience was not about needing new glasses. It was his body sending an urgent warning about his brain and blood vessels. 5. Dizziness and balance problems. The room starts spinning while you are standing perfectly still. Not gentle lightheadedness from rising too quickly. This feels like the entire world decided to rotate around you without warning. Your legs might suddenly feel unsteady walking down a familiar hallway. You veer to one side for no clear reason. Your body feels like it is trying to balance on a moving ship, even though you are on solid ground. These balance episodes strike differently from other causes of unsteadiness. Blood pressure changes usually happen when you change positions. Inner ear infections often come with hearing problems or cold symptoms. But mini-stroke dizziness can hit while you are sitting comfortably in your chair. The Oxford Vascular Study tracked patients and made a remarkable discovery. They found isolated vertigo in 51% of mini-strokes affecting the posterior part of the brain. More than half of these patients experienced severe spinning sensations as their primary symptom. Here is how this type of dizziness develops. Blood flow gets temporarily restricted to brain areas that control balance and spatial orientation. Your inner ear sends normal signals about position and movement, but your brain cannot process them correctly. The result? Your world tilts and spins, even though nothing around you has moved. Walking becomes dangerous during these episodes. Stairs look confusing. Doorways seem to shift. Your brain loses its ability to coordinate smooth, steady movement. The most concerning finding from the Oxford research? Medical professionals missed 90% of these balance-related warning signs during initial visits. 9 out of 10 patients received diagnoses like inner ear problems or dehydration instead of the correct mini-stroke identification. This happens because dizziness appears so frequently in seniors that doctors often look for simpler explanations first. Recent prescription changes, fluid imbalances, or minor infections seem more likely than brain emergencies. The critical difference lies in onset and intensity. These episodes appear suddenly and create severe spinning that makes movement feel unsafe. The vertigo typically lasts minutes before completely resolving. Many people dismiss these experiences entirely once the spinning stops. They avoid mentioning brief dizziness to their doctors, assuming it was just a passing moment of unsteadiness. But sudden, intense balance problems may represent your brain sending urgent messages about blood flow disruptions that require immediate medical attention. 6. Facial drooping. Martha was brushing her teeth before bed when her reflection looked wrong in the bathroom mirror. The right side of her mouth seemed to droop down slightly. She tried to smile, but only the left side of her mouth lifted normally. "Try again," she told herself, thinking she was just tired. She raised both eyebrows. Only her left eyebrow went up. The right side of her forehead felt heavy, almost numb. When she attempted another smile, her face looked lopsided and strange. Within 10 minutes, her face returned to normal. Martha convinced herself she had imagined the whole thing. This type of facial weakness represents one of the most recognizable mini-stroke warning signs. The Rotterdam study examined thousands of patients and confirmed that facial drooping serves as a significant positive predictor for accurate mini-stroke diagnosis. Facial drooping happens when blood flow gets temporarily blocked to brain areas controlling facial muscles. Unlike Bell's palsy, which affects the entire side of the face including the forehead, mini-stroke facial weakness typically spares forehead muscles due to how brain pathways are wired. The drooping usually appears on one side only. Your smile becomes uneven. One corner of your mouth may not lift when you try to grin. Speaking might sound slightly different because your lip muscles are not coordinating properly on both sides. Some people experience a heavy sensation on the affected side, like dental numbing that is wearing off. Others notice difficulty controlling saliva or food staying on one side of their mouth while eating. Family members often spot facial changes before the person experiencing them does. A spouse might say, "Your smile looks different today," or "One side of your face seems tired." Children and grandchildren frequently notice when grandma or grandpa looks funny during video calls. This makes facial drooping the easiest symptom for others to identify. Unlike internal sensations like dizziness or numbness that only the person can feel, facial changes are visible to everyone around. The temporary nature of facial weakness often leads people to dismiss it. When normal facial control returns, they assume whatever happened was not important. But even brief facial drooping may indicate that brain blood vessels need immediate medical evaluation. Martha should have called for emergency help the moment she noticed her uneven reflection. 7. Confusion and disorientation. Walking into your own kitchen and forgetting why you went there happens to everyone. But imagine standing in that same kitchen and not recognizing where you are. The familiar countertops look foreign. The refrigerator seems out of place. For several minutes, your own home feels like a stranger's house. This disorientation goes far beyond typical memory lapses. You might forget what day it is, even though you checked the calendar an hour earlier. Sometimes, you cannot remember your neighbor's name, the person you have chatted with every morning for 5 years. Family members often notice these episodes before you do. Your daughter calls and says you sound confused. Your conversation jumps between topics without connection. You ask the same question 3 times in 10 minutes, something completely unlike your usual sharp thinking. The Oxford Vascular Study tracked cognitive changes and found transient impairment in 38.9% of mini-stroke patients with an average age of 73.5 years. These episodes involve more than simple forgetfulness. Your brain temporarily loses its ability to process familiar information correctly. Different types of confusion emerge during these events. Some people lose track of time completely. Others cannot recognize familiar faces or places. Many experience what researchers call executive dysfunction, difficulty making simple decisions or following basic sequences like making tea. Working memory takes the biggest hit. You start a sentence and forget how you plan to finish it. Following conversations becomes challenging because you cannot hold on to what someone just said while they continue talking. These cognitive episodes typically last minutes rather than hours. When mental clarity returns, many people feel embarrassed or worried about what happened. They often avoid mentioning these incidents to anyone, hoping they were isolated events. The Oxford research revealed something alarming about these temporary cognitive changes. Patients who experienced them faced 4.3-fold increased risk for long-term thinking problems. Even brief episodes may signal vulnerability to more serious cognitive decline ahead. What makes this symptom particularly dangerous is how easily it gets dismissed. People blame stress, poor sleep, or too much information. But temporary confusion that disrupts your ability to recognize familiar people, places, or situations may indicate that your brain needs immediate medical evaluation to prevent more significant problems. Now that you know these 7 warning signs, but doctors wish more families knew this one simple thing: the 24-hour rule. Keep a simple notepad by your phone. When you notice any of these 7 signs, even if they go away, write them down with the time and date. Why? Because doctors need this information. Many seniors visit the emergency room saying, "I felt funny yesterday," but can't describe exactly what happened. Your notes become medical evidence. Share this video with one family member who checks on you regularly. Not for emergencies, for the in-between moments. The times when you think, "That was strange," but don't want to bother anyone. Your body talks to you every day. These 7 warning signs are not whispers. They're urgent messages. The difference between listening and ignoring could change everything. Remember Margaret from our story? Her neighbor saved her life simply by paying attention. Be that neighbor for someone you love, and let someone be that neighbor for you. If this video helped you recognize these warning signs, give it a thumbs up and share it with someone who needs to see this. Subscribe and hit the notification bell so you never miss our health tips that could save lives. Disclaimer: this video is for educational purposes only and not intended as medical advice. Always consult your healthcare provider. Thank you for watching.